Dr. Mike, and we are here today with Frederic. We're going to get to know Frederic a little bit better today. Welcome, Frederic. How are you today?
I'm well, thanks. How are you?
I'm doing great as usual. So we want to get to know you a little bit better today. So tell me a little bit about us. Where did you grow up, and what did you do as a kid?
Okay. I was born in New York, but lived in Miami for a few years, then relocated to a small town called Lake Worth in West Palm Beach. I'm one of 4 siblings. I like being outdoors, playing in the sand, going to the beach. Normal things a kid does. I was in the Boy Scouts and played sports, soccer and baseball in high school and junior high.
So very active and outdoors, like most kids should be, right? Today I'm not sure if that's what's happening, but that's another story. And then you were deployed, you became part of the Air Force. How did that happen? And tell us a little bit more about that.
My father was in the Royal Canadian Air Force, so I signed up to join the Air Force and went through training in Texas, and then a year and a half training in Mississippi. Eventually got stationed in Alaska, and was an electronic radar technician with the Air Force for a number of years, and then a few years with the Marines.
So electronic radar technician, make sure the radar works, huh?
Right, setting up and maintenance, right.
All right, and were you deployed somewhere?
I was in Iraq for 3 years.
For 3 years, what time period was that? Was that the first or second Iraqi war?
First.
First Iraqi war.
Right.
Okay. And you came home, what then?
I had some marital issues. I separated from my wife. We had one daughter. I worked for my dad for a while, on and off. And life caught up with me. I encountered some difficulties maintaining and keeping employment.
And what would you contribute that to? Is there any specific reason you had difficulty keeping a job?
Yes. Some things that I won't bring up right now, but childhood trauma and then military trauma and PTSD as a result of my service affected.
So the VA diagnosed you with PTSD?
Right.
So you suffered from PTSD, anxiety, depression, those types of things?
Correct.
Because of the things you saw at the war?
Correct.
Yes. Like many other of our local heroes here that we know of. Then today, because that's how we kind of met, you are a driving force in our community. So maybe explain to the listeners today, what is your mission today and what are you doing in our communities?
Right. So sadly, most Americans don't know their civil rights or constitutionally protected rights. There's another set of rights under various anti-discrimination laws, the civil rights laws, the Americans with Disabilities Act protections, the Fair Housing Act protections, and I was forced into a position where I had to learn them myself. And in the past 5 years, since 2018, I've discovered a vast untapped resource that I've discovered that my local government and most other federal agencies, including private businesses, aren't aware of their obligations and the rights of persons with disabilities. And a good portion of people don't even realize that they're disabled under these definitions. So I've been fighting for and advocating for other people with disabilities to make sure that they know their rights and those rights are protected and honored by the local government. And I've been doing that 5 years now.
The last 5 years you've really been helping people with the same or similar issues and problems.
Right, just trying to bring it public, bring exposure to it, and make myself available to educate others as I've educated myself. And I've drawn on the knowledge of a fellow disabled veteran who goes by Blind Justice, who's helped me see things through his blind eyes.
Yes. No, that's great. I mean, serving others is always something that we all should be doing. But then things got a little bit of turn the beginning of this year. You went for a checkup, and tell us a little bit about the diagnosis that we recently incurred.
Sure. I tried to go to the VA first. I've had some difficulties since the start of the pandemic getting in there. because I'm claustrophobic, and their VA is supposed to have a disability coordinator, what's called a disability coordinator, to facilitate accommodating a person's disabilities. They didn't know who that person was. I couldn't get into the VA, so I didn't have access to VA services since 2019. I went in 2023, earlier this year, to get in there for some urgent symptoms I was having, and was told, well, you have to reapply to get back into the VA. So I waited for a friend to come up to accompany me to the hospital, because I have a service dog and didn't want to leave my service dog uncared for, and I didn't want to, she's getting old, and didn't want to take her with me to the hospital. And went to Advent Healthcare, and was having some pain in my testicular region and groin region, and they did a CT scan and found several masses of 4.5 centimeters and 2.5 centimeters that was likely metastatic colorectal cancer.
Yes. So you had the CT scan done. We saw 4.2 centimeters, I believe, of a mass, right? So you've now been diagnosed with colon cancer, rectal cancer, correct?
Right.
Okay. Very good. So thank you for your community service. And we're going to try to help you with these medical issues. Let's put it that way. Is there anything else you want to share with people about you, about yourself? I know I saw a picture. You have 3 grandkids, right?
Right.
Are they local?
They're in South Florida.
South Florida. Well, that's within driving distance, so that's good.
It is.
So you got many things to look forward to. Is there a reason you're not going the conventional route, meaning chemotherapy, radiation, those types of things?
You know, with my experience taking the medication that's prescribed as an antiretroviral therapy, the traditional route, for me personally, doesn't seem to be what I'm willing to risk for the reward. You know, I've had to take my own health into my own hands, because I don't believe the health care that I was getting through the VA was in my best interest, and I researched things myself, and I think that the holistic natural approach by things that God has given us, which have less side effects. And one doctor that I researched said, why is cancer the only illness that we treat with a toxic substance? Why are we administering chemo and radiation? So it's my personal choice, and I think it's a better option to try alternative medications first.
Yeah, and obviously I agree with you. A friend of you reached out to me. That's how we got connected, and that's how we're going to try to put a holistic approach together with different modalities that we can do this. So, you know, good luck the next 90 days. We are just going to help you out.
Appreciate it.
It's a beautiful day here in the high country in Arizona, but for some people, each day is a struggle. Our friend Fred is struggling with cancer, but he has chosen to overcome this obstacle by following natural law and using natural remedies. With his limited funds, Fred needs help in paying for the natural remedies and the services to accomplish the goal of being cancer-free. Please help us as we join together in helping our friend get better. You can also follow this process as it's being documented step by step. My name is Luke Scott. I'm a former Major League Baseball player, but now I'm a full-time Viking. If you want to join me in the quest to help Fred out and support him financially, click the link below at the Give, Send, Go.